Hi, my name is Kim Yu, and I am the immediate past chair for the Michigan Academy of Family Physicians. I am currently working for CEP America as the Director for Quality and Practice for 25 of their urgent care centers throughout the country.
And my name is Maria Gonzalez. I'm a family physician in the state of Texas, and I work both with family medicine residents and medical students. And today, as you well said, Kim, right, we're here to talk about resiliency.
We sure are. We know that it's a big issue. So many docs are actually suffering from burnout. The statistics say that it's over 50% of family physicians have burnout. And we know that building those skills and resiliency can help not only improve feelings of job satisfaction, but improve how people work as well.
Yeah, and also, it is going to improve patient quality, right? Quality of care and patient safety. So tell me, right, Kim, what have you learned about resiliency throughout, your 10 plus years in family medicine?
I really needed to spend time to really focus in on those things that really mattered to me. What was it that I really wanted to do with my life? Was it all the different advocacy work that I'd been doing? Was it the work that I was doing in urgent care? And I really needed to focus in on what was really important to me.
Yeah, and that's very interesting what you're saying, because when we look at the studies, right, it has demonstrated that it is essential, right, for us to align our passions and our values with our job, right? So it is so important that what we believe about family medicine, our personal values, our personal, even skill sets that are different from just being a clinician, that we are in a work environment that we can thrive,
Absolutely.
right? And that is aligned with who we are. Sometimes we just focus so much on being the perfect doctor, but it's not about the doctor that I want to be, it's more about the person that I am.
Exactly.
How would you tell a medical student, right, to just stay focused in that? Because we're going through med school, and I just finished, my fellowship 3 years ago, right? So I'm kind of like brand new, but nobody through medical school ever told me that this was going to be like, it's so hard in terms of like just staying focused, right? And nobody tells you when you're in medical school, well, you need to take care of yourself, because as a provider, as a healthcare provider, as a physician, you're just at risk, right, of mental health, right, or suicide. So how do we stay there?
Suicide, it's just awful. I personally have known 2 physicians commit suicide, and it was a devastating loss, not only for us who are friends of these physicians, but their families, their communities. It's terrible. We need to have things in place. From an organizational standpoint, there needs to be steps taken in each different organization in medical school to really help protect the students. And so are we taking those steps? If you're a teacher, if you're in faculty, and if you're in a position, a dean, anyone who's in a position that is able to take care of these students, even the students themselves, are they able to advocate for themselves? We need to put things in place to protect our students and our residents.
Yeah, and one of the things that I have learned, working with both medical students and residents, is that sometimes we need to let people know it is okay to just, say, well, I need a break, right? What do you think about just saying I need a break?
It's not only just I need a break, but sometimes you have to say no.
Yes.
Right?
Yes.
Oftentimes we are we're trained to do everything, to be the first person on the ward and be the last person to leave. Whether we eat, whether we sleep, whether we go to the restroom, it can be an issue. To take the steps for self-care and to even just say no to certain things.
Yeah, and I think that that's really good. One of the things that I have learned is also, besides saying no, like what are the own boundaries that you're going to have for yourself, right? At what time you're just going to disconnect from the emails from work, right?
Absolutely. And we have to figure out different ways to be able to really realign what it is that we want to do, our mission in life, and the things and the values that we hold dear to ourselves with the values of our own organization. to find a position.
Yesterday in one of our conversations that we were having, right, with all of the trainees that are here at the conference, somebody mentioned like how, medicine still has not gotten it, right? And how how much important it would be, the wellness of the healthcare providers rather than how can I make them more productive, which a lot of the time focuses how can I help you see one more patient, right? How can I help you, right, be more faster, be more efficient?
But there are studies that show that if you actually protect your physicians and help them build the resiliency and to have happy physicians, they're actually more productive.
Yes.
They see more patients, the patient satisfaction scores are better, you have less turnover, and for each physician that actually has to be, that we lose in an organization, it can cost hundreds of thousands of dollars to find and recruit another physician.
Yes, and that's true. And I think that, the more we can, the organizations can also get involved, right? The hospital administrators, right? As you well said, the deans of medical schools, right? The program directors, the chairs, right? So that change can, happen not only from the bottom, but also from the top.
Now, we have talked about in our talk different steps that people can take, and
Yes.
there's some wonderful resources that are available out there from the Academy and also from different other organizations. The AMA has Steps Forward.
Yes.
And, what other things that we can tell people to do?
Yeah, so we were talking about how important it is to first focus, right? And focus is just about our passions, our values, who I am, what do I really enjoy and love about family medicine, right? Because that's the beauty of family medicine. We can do so many things, right? And also taking into consideration not only what our clinical skills are and our clinical knowledge, but do you have leadership? Do you have administration? Are you good at writing, right? Are you good at public speaking and communication, and develop also in those areas? Then we talk about renewing ourselves, right? And for me, and for every person it's going to be different. It can be as taking some time to read your favorite book. It can be some time to connecting, with people that you haven't seen in a long time, family members, friends.
Spend time to really know what it is that energizes you.
Yes.
So that you can restore your energy accounts.
Yes.
What do you say to people who say, I don't have time to take an hour out?
Yeah, so I think it's about doing small things, right? If you can, for example, take a 10-minute, 15-minute break, and if you're in the hospital, just come outside of the hospital, right? Take a walk around the hospital, just connect, with nature, right? It's very essential, so you can do very small things.
The third step we like to talk about is support and how important support is. Now, I know that for myself, when I was going through all the different things with my father passing, my support came obviously from my family, my friends, my immediate friends.
Yeah, so I think that, support is really essential, right? There's the support that you can get from your family members and your friends that make you feel love and value, right? And then there's also very important the support that you can get from your colleagues, right? And something as, simple as just like debriefing after you have a challenging experience with one of your patients.
The last thing is about speaking out and the importance of being able to speak out and tell others if you're actually suffering from burnout or if you need help.
Yes, and I think that it's not only you speaking out for yourself, but also you speaking out from, for your colleagues. So it's a matter, family medicine, we are a family, so we should be taking care of each other.
So in closing, we just wanted to say that you, the Family Physicians of America, you're freaking awesome. And it's not a job title, it's who you are. Thank you for doing what you do every day.